Well, hello everyone. I'm the director of our New Zealand registered not-for-profit charitable educational trust called Common Knowledge, and we hold all of the skills that hundreds of mothers and fathers developed to prepare their body for childbirth and the skills to cope and manage during birth, for all births, without exception. We get pregnant to have a baby. Our baby's birth is important to us, and fathers and mothers developed skills so that they could use the skills to the activity that they were going to go through to birth their baby. The skills were developed in the early 1970s through the mid 1980s in order to continue to grow, mature, and broaden and deepen and be able to give us skills for all of the nitpicking little gaps that we felt that occurred within our birth. When I gave birth in 1970, there was a 4.5% cesarean rate, and all of us labored. 95% of us did. And in the US, we all went into the hospital where we had assessments, monitoring procedures. And it was at a time where it was basically follow your doctor's orders. We didn't think anything of it. Whatever went on, we just accepted it. We accepted it as a step up from not having any medical care, and that the modern medical profession was going to assess and monitor, do procedures when necessary to safeguard the health and well-being of ourselves and our babies, because 95% of us labored. And because 95% of us labored, which meant that all of the risks today, we just labored through all the risks, the twins, the breaches, all sorts of high blood pressure, overweight, preeclampsia. We just all labored. Many of us suffered because we lacked skills. Some of us found birth easy. Some labored for hours and others labored for days. Most of us had a good outcome, even though we had risks, because there are many more risks than eventuate as problems, and there are many more problems that eventuate as tragedies. But some of us had tragedies. And so we were dealing with the maternity service of the day. And I'm so old that I have lived through 3 evidence-based practices in maternity systems. In the 1980s, the natural childbirth movement became global and it became very strong. And it started to say to women, you should be able to say no to medical care. And we were going to write a birth plan. We knew what kind of birth we wanted, and we were supposed to articulate this to the maternity system, and the maternity system was going to magically provide us with the birth that we wanted. Because I'd been involved in birth in the 12 years prior to that, I knew that wasn't realistic, and that the messages we as women were giving one another was going to cause a huge amount of confusion, and it was going to increase the rate of shame, blame, disappointment, anger, frustration, bitterness, and birth trauma that, frankly, my generation of women didn't have. And the reason that we didn't have it was that the first childbirth classes that were being taught back then actually were all skills-based. So as poor as the skills were, or as unable to adapt or adjust or be sustainable, they were something that we had never had before. So multiple millions of us reduced our suffering, even though we were subject to all the assessments, monitoring, and procedures that went on around us. It's a great idea to have birth plans, but what happened with the natural birth movement is that they dismissed the concept that we should be skilled. And that's a huge mistake. So women started to say to each other, women have always had babies, we know how to do it. And you would think we would have used common sense, because if women had really known how to do it, then women wouldn't have suffered so much in childbirth. And what people seem to think is that either everything is fine or a woman's dead. So that's not the case. There's many things in between that, right? And women do not know how to birth. We will give birth one way or another if we're pregnant. That's guaranteed by biology. But that doesn't mean we know how to do it. And it doesn't mean that we should just let it happen to us. In fact, we need to elevate it to being an activity that it is, takes place over time. We have to do it. We're the only ones doing it. And we should want all of us as women and men who are helping us to have the simple, effective, adjustable, sustainable adaptable skills that Birthing Better mothers and fathers developed, or any other skills-based method that you want to use. You should just treat your coming birth as an activity you have to do, and you'll do it better when you're skilled. So how should you really respond to those who work in the maternity system? Well, first of all, you have to treat them as human beings. Okay, that obstetrician or that staff labor and delivery nurse or that hospital midwife, there's somebody's sons or daughters or wives or husbands or a relative or a friend. So they're just human beings. And they're in a profession that they either like or they don't particularly like. And they're doing their best to serve all of the women and men, if the fathers come, who are birthing where they work. You're not the only one. They do not have any obligation to you at all to treat you the way that you believe that basically some stranger should treat you. We have been told that birth is this unique place where we need around us safety. That's not true. Women have been birthing in Syria throughout the war. They birthed in Vietnam. They birthed in Indonesia during that tsunami. They birth whether they're living in poverty or whatever. Women don't have to be safe to birth. Birth is going to happen one way or another. And so when the growth of the global natural birth movement occurred in the 1980s, the belief really was that birth was sort of like wedding planning. And it's not like wedding planning. You get to plan all the things around the wedding, and then you have this sort of passive involvement, whereas birth, you have a very active involvement. You have to do the activity moment to moment. And the people around you are working. That's their employment. They may love it, but it's their employment. You have no idea if you arrive at the hospital or if your midwife comes to your home, whether she's been up all night at another birth on the back end of being up all night with problems for other clients. You have no idea. So this idea that we should expect the maternity services to provide us with this beautiful birth, that's not their responsibility. And in some ways, that's why we have so much difficulty as a New Zealand Charitable Trust to get the concept that mothers and fathers develop, that when you're pregnant, it's normal and natural to self-learn birth skills and use those skills when you work through the activity of birthing your baby. Part of why we have difficulty getting that message across to you is that the maternity service doesn't believe that it's their role to inform you that you were doing an activity and you would do that activity better if you were skilled. They've never been involved in doing that. Even when Lamaze was taught at a gazillion hospitals in the United States, you would never have an obstetrician ever say to you, it's a good idea for you to take the class and learn some skills. And why is that? It's not that they're being mean. It's just that that's not within their purview. I mean, it's sort of like you take your car to a mechanic. They don't ask you if you know how to drive well. So you need to understand that your role in birth is that you're going to do the activity. And you may be forced to, or you may be choosing to do that activity in a hospital. So we'll talk about hospitals first. They have no obligation at all, and you need to stop thinking that they do. You have the obligation. It's your baby's birth. Whether you have candlelight or not, if you are not coping, that candlelight isn't going to do dick for you. That music that you want played, them to give you informed consent if they want to do anything to you, none of that is going to matter if you're feeling out of control and you're not managing well. And if you do use skills and you are coping and managing well, you're going to be able to talk to those people around you in a dignified manner because you're coping and managing well. And then they will negotiate with you. They need to do the assessments and the monitoring procedures because that's their professional obligation, whether you like it or not. And if you don't like it, don't go there. That's their stomping ground. So when you go into their stomping ground, then expect them to do the things that they feel are necessary whether it's right or wrong or good or bad, that safeguard the health and well-being of you and your baby, and that are required by perhaps state law, country law, insurance directives, policies in the hospital, guidelines to practice, whatever you want to call it. Okay, they're doing their job. And I don't know, I mean, I know where it came from, but I have never understood why there is a belief that we as birthing women should be so demanding of our birth providers. I just don't get it. Now, I've been involved in this for 50 years, so 50 years of saying to you, I don't get it, is, a statement. I have talked to tens and thousands of women around the world. Everybody would like somebody who sees them in pregnancy to also be at the birth. That's really what people want. They don't even want that same person to be with them after the birth. Then they would just like somebody to cook and clean and take care of the kid, the other kids, and shop and do the laundry. That's what they'd really like for 6 weeks. But everybody around the world would really like the same provider to be with them at the birth and after the birth. And that's very exceptional. New Zealand has that system. We have a wonderful midwifery model of care that somehow, on the one hand, is extremely successful and could be a global model, and on the other hand, is a total bust because it's based on a partnership model, and it's based on pregnancy and childbirth or normal life events that rarely require medical care. Yet midwives feel that they need to go to school for 4 years to deal with something they consider to be normal and natural. But they don't think that women should be skilled at all. They just think that they should trust birth and then be left alone to discover birth. So on the one hand, it's very successful. On the other hand, it's abysmal failure. And the abysmal failure part of it is going to far outstrap the success of it because the cesarean rate has more than doubled. It's like it is in any modern maternity system, and it's under midwifery care, and they're exhausted and then cannot continue the way they're going. And they absolutely ideologically refuse to understand that if you're going to have a partnership, you should have a strong partnership. Both people should be skilled for the tasks that they have to do. Your obstetrician doesn't give a damn, really, nor do the labor and delivery nurses or the staff certified nurse midwives. They don't care. If you don't cope and manage in birth, they have medical pain relief. Or if your labor goes on and on and on and on, they'll do a cesarean. They don't care. It's not that they're not caring people. They don't care if you do that because they have the skills to deal with the repercussions of you not being skilled, which is an epidural, right? Or augment your labor, or a membrane sweep, or something else. So you have to inspire yourself to become skilled. And the reason that Birthing Better families did inspire themselves was simple. We were going to have a baby, and we wanted to have the skills. We wanted something to do for ourselves to prepare in the privacy of our own homes. And then we wanted to commit to having skills to work through our baby's birth journey. So we did. And we developed skills for every type of birth because we have every type of birth. It's not as though one type of birth should be focused on over every type of birth. Birth is birth, and our baby's birth is important to us. So we can always use skills to birth our baby. So when you're writing your birth plan, you're thinking, well, I don't want pain relief. I don't want an epidural. I don't want to be induced. I don't want this. I don't want that. I don't want this or that. Then really the response is, well, what are you going to do to stop yourself from having to have those things? And if you're going to have those things, for whatever reason, whether it's a standard of care thing or whether it seems apparent at the time that those are things that would be best in terms of whether you like it or not, how are you going to cope and manage? Without skills, you're not. And that's what we've seen since the 80s. We've seen a bunch of women really, really pissed off because they did not give them the birth that they wanted, or they did assessments, monitoring procedures that the women didn't want. But when we are skilled, we don't place as much anxiety on those things. Did we like every internal done? No, but we use skills to cope better. Did we like it when our labor stalled? No, but we continued to use skills because it was our baby's birth. Did we like it when we were told that we had to have another cesarean and we really wanted to try for a VBAC? No, but we used the skills on the way to the hospital while being prepped and in surgery because it was our baby's birth. So you, we have to change how we're approaching childbirth now because the system of a choice-based childbirth concept isn't working. Women who are choosing to have the so-called ideal natural birth are not succeeding, and so they feel they've failed. Other women who are going to the hospital, if they want to have less assessments, monitoring procedures, often find it's very difficult to do that because of the standards of care. On the other hand, if we go into birth and we are coping well and we're using skills and we're working together well, from my experience with thousands of birth professionals and families, birth professionals will negotiate. They just want you and your baby to be okay. And your behavior, what they see, how they hear you, because they see hundreds, if not thousands, of women every year doing what you're doing. And they know that they are working with unskilled families. They can see it, they can hear it. And in the 60s and 70s, when my generation gave birth, they saw and heard people trying to cope using some level of skills and fathers trying to help. But by the 80s, fathers were told they shouldn't be coaching. They should just be supporting women's choices. So now you see very few men knowing what to do and how to help. And that just adds to the shame, blame, disappointment, anger, and frustration that so many women are left with in birth trauma. And this is so unnecessary. It's unnecessary because sadly, the natural birth movement really, really is an anti-medical movement. And they started the hospital versus home birth, the midwives versus obstetrician, natural birth versus medical birth. And you can hear it today. When I immigrated to New Zealand, there was a midwifery, autonomous midwifery profession that controlled all of their education to have direct entry midwives who could either work in a district health board or be a community midwife or an independent midwife. And that profession within its own professional body called midwives who worked in hospitals midwives, and elevated the independent or the community midwife, the home birth midwife, to being the real midwife. And we can't do that. It was shocking to me then. It's shocking to me now. I don't know how to explain why that's so shocking. It places an emphasis on a type of birth and a place of birth and a care provider that diminishes everybody else's birth and all the other care providers. And I find that to be problematic because 100% of pregnant women are going to give birth one way or the other. The birth of our baby is important to us. Each of us should be able to have and achieve an empowered birth, regardless of where that birth occurs, regardless of who's there, regardless of our circumstances, beliefs, our choices, lack of choices, change of choices, or what happens to or around us. And the best way for us to achieve that empowered birth is to grow a skilled birthing population for everybody, that it just should be normal and natural when you're pregnant to self-learn birth and birth coaching skills and then use those skills to work through your baby's birth journey. So how do we deal with the birth professionals? Sometimes we go to the hospital beforehand, but there's no guarantee that anybody we meet are people that we're going to have at our birth. When we go to the hospital, we introduce ourselves and find out how long the when the next shift is going to come on. If we have the ability to ask one of the staff people to be, attend us and do the assessments, monitor, and procedures, we do that. If we've learned skills, we inform them about the skills that we've learned, and we often encourage them to praise us if they feel we're coping well and encourage us to use the skills if we look like we're being stressed. We tell them what it is we would like when we get there, and we continue to have a conversation. Because we're using skills, we're more likely to be able to converse because we cope better and we manage better. If they insist that we have an assessment or a monitoring or a procedure that we don't want, we try to negotiate when that happens or how that happens, and we continue to use the skills. We just go, we came here, this is their space, these are the things they feel they need to do. This is our baby's birth. We are not going to let anything interfere with our ability to use skills to work through our baby's birth journey. And they will never, ever interfere with that. They don't care. It's not that they're uncaring people. That's not their job description. So they don't think about it. You have to think about it because it's your job description to do the activity of birthing your baby. So when I gave birth last, I ended up with an 8-week premature labor in a strange hospital. And on the way to the hospital, I had to make a decision, use my skills, knowing that I was going to have a lot of stuff done to me to safeguard the health and well-being of my baby, or I was going to be passive. And I chose to use my skills because that's what I'd spent years and years and years developing with hundreds of families and had watched them use their skills. So I used my skills and I worked with the staff and I worked with the obstetrician, and they just let me do the birth myself. So I birthed him myself, and then the pediatrician took over, and I then had to go into pause mode while they fiddled with him. And once he checked out fine and I'd spent the night, I took him home. They wanted me to come back every few days to have him checked out. That was fine with me. But because they had seen me manage and cope and behave and work through and handle and stay on top of and feel in control and birth my own child in a hospital environment with what they considered to be a high-risk birth, once they knew everything was fine, they just all calmed down and enjoyed it. And we worked together. So I can't stress enough how important it is for you to recognize that these people are there to just try to safeguard the health and well-being of you and your baby. They're not there to give you the birth you want. You're there to give you the birth you want. And if that means that you have candles in the room and they say, no, you can't, you've still got to do the activity of birthing. If you can't have a support person or a doula because of COVID, that's no different than a woman in Afghanistan who's so far from the hospital. I mean, really, honestly, modern people have an overblown expectation of what they deserve. It's an entitlement issue. And you're not entitled to anything. What you need to do is to become highly skilled to birth your baby. And it doesn't take long, 5 to 15 minutes a day for 16 weeks. Is it worth it to you? Should be. How much time are you spending investigating birth plans and writing them? How much time are you spending looking at how you want to decorate your baby's room or what you're going to get? How much time are you spending taking care of your other kids? How much time are you going to spend once this kid is born? But this kid is already here. You're pregnant with it. So you have an obligation to yourself and to your child to be as skilled as possible, just as you do once it's born. And so what we want to leave you with is you want to thank everybody who's there. You're privileged. You can go into a hospital. They'll take care of things if there's a problem. And you want to behave, cope, manage, work through, deal with, handle, stay on top of, and feel in control as much as you can, even though lots of things may happen to and around you that you'd prefer didn't, or even if you hated every moment of it. If you're a parent, you can go through days hating being a parent, hating your kid, hating your partner, hating your work. But not liking something doesn't mean we stop using skills. But in the childbirth, because there's no societal expectation that you become skilled, even some women who have learned some skills will stop using them if it doesn't look like they're getting the birth that they wanted. So we have to change that. And the first place to change it is to realize that you're always in a partnership relationship with every birth professional, whether you're seeing them in pregnancy and they come in to do the birth, or whether if you go to the hospital and their staff. As soon as you meet that person, you're in partnership with them. They're bringing their skills. You need to bring yours. Now, how does this impact home birth midwives? Well, in the early 70s in the United States, there were no midwives. It wasn't legal, but there were a lot of lay midwives floating around. And what I saw back then was that they were exhausted. They committed to too much time and energy to be with a woman. They had some sort of a misperceived belief that a midwife in traditional communities gave women total support in a woman's life, and that's just not accurate. I mean, in traditional communities, it was most likely your aunt or your mother or your grandmother or your mother-in-law who helped you at a birth, and you lived with them. You weren't some stranger. And I saw midwives who had families spend more time with pregnant women than they did with their families. I saw midwives who took care of pregnant women more than they took care of their own health. And this was silly back then. And it's remained to be absolutely foolish. And New Zealand midwives are no different. They wanted to see themselves as separate from the nursing profession. And the way they did that was to say nurses work on a shift. So we'll give women 24/7 care. But how does that align to the concept that pregnancy and childbirth are normal life events that rarely require medical care? And that's the New Zealand midwives' mantra. So if that's their mantra or their verbal logo, and they've chosen to go to school for 4 years, and they believe that they should give women 24/7 care, those things just don't jive. They make no sense together. If you believe that childbirth and pregnancy are normal life events, then why is anybody seeing a woman once a month or every 2 weeks? It's just a normal thing. Why are you doing that? Why are you giving women 24/7 care if you think that it's a no-brainer, that birth is somehow a no-brainer and pregnancy is just a thing, it's a normal life event? Why are you doing that? Right? So it makes no sense to say one thing and then do something else. And it gives us as women a very, very mixed message. So if you're a care provider working with clients, then you can right now start to educate your clients that it's that they are going to have to do the activity of birthing their baby. You can give them a handout of skills-based methods and tell them that you want them to learn some skills and that from 24 weeks onward, those skills will be put in their notes, just like their choices are, their lab tests. And at their birth, if they look like they're using their skills, you're going to praise them. And if they look overwhelmed, you're going to refer back to the notes and encourage them to use the skills. That's what you can do to grow a stillbirthing population for your own practice. And how does it change your practice? Profoundly. Because if you really look at your practice over the past X years, you're not going to have been working with many skilled families and many skilled dads. And you can up that. You have really no idea. I mean, you've been at some really phenomenal births and some births in which women are obviously using skills. You know how joyful that is. You know how wonderful those births are. And you can have those births with women wired for sound out of every single one of their holes, because what's happening to around that woman has nothing to do with her behavior or ability to cope. That is determined directly as to whether she has self-learned skills or not and is using them. So if you're a birth professional working with individual clients, it's time for you to strengthen the partnership you have with them and expect them to be skilled for their baby's birth. You're not doing it for them. So that's about all I have to say on this topic. I know a lot of people I start talking and they just want to close their ears and tell me be quiet, but we can't be quiet any longer. And we can't be quiet partly because of COVID, but partly because where else are we going? We had skills coming out of our ears in the 60s and the 70s with Lamaze and Bradley. Everybody was going to those classes. Everybody was practicing. Everybody was using those skills around all the assessments, monitoring, and procedures of that evidence-based practice. And then the natural birth movement in the 80s told us that cows and cats aren't taught to birth. Women don't need to be, and they dismissed skills actively. They so actively dismissed it that they told fathers to stop coaching, stop being skilled, and they told women, breathe any way you want. Well, no, because when women are going, oh, oh, or they're telling you that they lack skills. We want each other as women to have the dignity of working through our baby's birth journey with as large a range and broad a range of skills as possible. That's what we have to want for each other, so that when we look back on our birth stories, we realize that you might have said, oh, I could have used my breathing skills better, but at least you knew you used some. Or I didn't really like how that person treated me, but when I relaxed and my partner and I really breathed together and relaxed together, I was able to just let that go. That's what we want. So I'm going to end and get on tomorrow with another one of my talks in this You in Childbirth series. So take care and see you later. Bye-bye.